University of Ottawa. Hello and welcome back.
Hello, thanks for having me.
I was reading an explainer piece today where there were a lot of scientists saying, no, coronavirus is definitely still here. It is not winding down, but I'll put it to you. Where do you think we are COVID-wise?
Well, we're still in the thick of it. I don't know where this narrative that we're done with it comes from. Just because you think you're done
Well, I
with
think
it.
it comes from the fact that people are looking around and there's not a lot of restrictions and people are resuming activities, most likely.
Right, so the response to the pandemic might have waned, but the pandemic is still with us. We have like 100 deaths in Ontario this week alone. The number of new cases now is like 10 times greater than it was this time last year, to the extent that we can measure these things. The only difference really is we have high vaccination rates, and that's not a small difference. That's huge. That means that this is not the existential threat to most people that it was 2 years ago. But it's still a threat to society and to our systems and possibly to our health if we get infected repeatedly. So by no means is this over.
What do you think about the dropping of the 5-day isolation rule?
In a word, I think it's nutty. I don't think it's appropriate. I think especially this time, we're about to go back to school, expose a lot of people to indoor settings unmasked. So we're dropping all the restrictions and taking away the isolation rule at a time when our healthcare system is in peril. It strikes me as an irresponsible thing to do. Like, it's rolling dice. Maybe we'll get away with it, but why are we really taking that chance? It doesn't make a lot of sense to me.
Given the existence of the vaccine, as you've mentioned, people getting the first 2 doses, then the booster, and now there's the 4th dose and the bivalent vaccine that is more tailored to Omicron. What do you think we can expect to see this fall?
Well, not a lot of people have actually been boosted, first of all. And not a lot of kids under 11 have been vaccinated at all. So there's still swaths of the population that is not as well protected as they could be. So I think the number of deaths will be smaller than they were in previous waves. The number of hospitalizations might be on par. But it's more the number of people showing up at the door of the hospital I think might be challenging. And I'm concerned about that. Now, what's the solution? I think the solution is you get vax to the max until we get better vaccines. And they're coming. Those intranasal and pan-coronavirus vaccines are coming. When they do, that should put a stop to transmission to a large extent. Until then, I think we had to really take a good look at our public health tools and use them wisely and voluminously.
What about the fall boosters that we've been hearing about in Ontario, the Spikevax, better known as Moderna, the Omicron vaccine? How much of an impact does that actually have?
I don't think it's going to have that much of an impact, frankly. The amount of additional antibody production against Omicron that it offers is about 22% more than an irregular boost would be. That's not nothing. That's good. It's not really enough to change the scope of the pandemic sufficiently, especially since if you get it now, you won't be sufficiently protected for a month from now. So, and not enough people are getting boosted. So all that combined suggests to me that it will help, but it's not going to noticeably blunt what is going to be a wave. Now, what might blunt the wave is people just making good choices and the fact that we have sufficient population immunity in the population to prevent an overall assault on our healthcare system. But a lot of people are going to be getting infected, most quite mildly. Let's be plain about that. Most will not suffer from this. But if enough people get sick, then that handful that will suffer unduly and possibly clog our healthcare system.
Let's go back to the better vaccines that you had briefly mentioned there, Raywat Deonandan. Tell us a bit more about those and what makes them superior.
Intranasal vaccines have been tried in other diseases in the past, influenza, for example. They're used commonly in the veterinary population, so horses and dogs and so forth. The idea is you spray it in your nose. And if you think about a fight breaking out in a disco, you'd rather have the fight outside the disco and have the doorman keep it out from getting inside in the first place. So that's what intranasal vaccines really are. It allows you to mount your immune response where the virus enters your body, your nose, your mucosa. And by doing so, you prevent the probability of being infected in the first place. The clinical trials so far are quite promising. Russia claims to have one ready to go to market. India claims to have one ready to go to market. In the Western world, we have dozens approaching phase 2 and phase 3 clinical trials. It would be nice if there was more priority placed on funding those to get them to market faster, but I'm quite bullish on those. And the pan-coronavirus vaccines are more of a holy grail, but there's some progress there as well. If you can imagine a vaccine that handles all variants, present and future, no need to update them and upgrade them. That's what that category will be. And people are working on that. So there's a lot of hope down the road.
Yeah, that category, the spray, really sounds like the future of a COVID vaccine.
It really does, especially since a lot of people are working on them, and there's a lot of good data in literature for animal populations and phase 1 trials suggesting it really does work well. We don't know what the other shoe will be. Maybe it increases rates of asthma or something like that. We don't know yet. That's why those clinical trials are needed. But in terms of producing a response that keeps infection from happening in the first place and therefore transmission from happening, it's a really good bet.
When you look back and examine the 1918 pandemic, and then you look at what we've been through now, how is it that COVID has been able to persist this long?
COVID has persisted because of its immune escape properties and the fact that it keeps mutating into better immune escape versions of itself. The 1918 flu virus also mutated, not nearly to the same extent as far as I can tell. But an important parallel is that the 1918 flu is still with us today. Its descendants still bug us every couple of years in a really bad flu year. And the same way, the descendants of COVID are going to bug us for decades to come. But the idea is with sufficient population immunity and good vaccination, it shouldn't be a society-stopping ordeal anymore. So there was a pandemic back in the 1890s, that I think the Asiatic flu it was called, or the Russian flu, that many people think was caused by a coronavirus now. And that same coronavirus today is one of the viruses that gives us the common cold. So it's entirely possible we're looking at a future common cold decades from now.
Yeah, and I think people think about COVID-19. Can we tame it? Can we bring it down to a much more manageable level? Are we still using the term endemic? Is that still relevant?
It's kind of irrelevant. I mean, what's endemic really mean? It really means no waves. And endemic isn't good. Endemic just means it's with us all the time. So, but it's possible to have endemicity that is manageable. If you think about measles and chickenpox, those are endemic diseases. It's just that public health has its foot on its throat, so it doesn't bother most people. That's kind of what we want this to be. Get it to a low incidence rate and hold it there using the tools at our disposal, which are vaccination, contact tracing, treatment, etc. We can do that. It takes effort, will, and conscious effort to do so, which I'm hoping people still have in abundance. But endemicity in and of itself is not a goal that is worthy. Low endemicity, manageable endemicity is an acceptable goal that I think is quite reachable for us.
How much of getting to a better stage, or not being in stages where we're in waves or blips, whatever you want to call it, lies in getting people all around the world vaccines?
Ooh, that's a good question. Well, that would be the ideal. But if they also just get infected a whole bunch of times without vaccines, that might do part of the job also, although it does seem that natural infection confers limited immunity, depending on which data you want to look at. But the ideal would be getting the world vaccinated quickly. That way we get out of this much faster and reduce the probability of more variants arising. So you could wait for mass infection, but that will take time and may not be complete, and then you have the risk of more variants emerging. So, of course, vaccination of the world is the preferred pathway to take.
Raywat Deonandan, thanks so much for sparing the time. Appreciate it.
It's my pleasure. Thank you.